One of the great blessings that I have is that I'm an osteopathic physician, so I can prescribe drugs, and I can also prescribe exercise, and I can prescribe nutrition, and I can prescribe structural medicine. Sometimes you need drugs, you need medication to get the job done. If you don't sleep well, you are not healthy. If we've exhausted every other opportunity, if you're exercising 30 minutes, 3, 4, 5 times a week, you're doing the nutritional protocol, your sleep hygiene is excellent, and your lights are out, and you're going to bed on time, and all that's good. And your relationships are good, and you're happy going to bed. There's sometimes people need medicine. They need medicine to be able to sleep. Really commonly used medicines are all problematic. Ambien, it's a good drug. It works to put you to sleep, but it can change the way that you think. And it has other problems, including causing ringing in the ears, confusion. There's a question whether or not it accelerates degenerative brain disease. So it's to be used for temporary purposes, 30 days, 60 days, 90 at the most, then stop and then try something different. So Ambien, half of a pill is way better than a whole one if it works. 5 milligrams, not 10. Lunesta is probably one of my favorites. It comes in 2 or 3 milligram flavors, those strengths, and they both work, and they're both good. Lower strength, of course, is better. Lunesta actually causes the brain to go through its normal phases of sleep, so it's a whole lot better. It has a bitter aftertaste, and that's a deal breaker for a lot of people. There's also medicines that are kind of in that Valium class, which are real old school, very temporary use in the event of an acute family problem. You know, your kid's going away to college, or there's a divorce or something like that. You may need that for a month or two. Super addictive. Not to be taken lightly, not to be used as on a long-term basis. They all work. There's newer drugs. Belsomra is one of the new ones. It acts a lot like Ambien, though. It has a lot of those same side effects. It doesn't seem to be quite as bad, but it's newer. So my thought with all of this is sleep drugs have their place, should be used in a very limited way. But muscle relaxers are also excellent for sleep. So baclofen, Soma, Flexeril, with a doctor who knows what they're doing, they can use these agents as well in a really safe way, also to treat your musculoskeletal system, like if you're tense or you have pain. So you can use muscle relaxers for sleep, you can use sleep medicines that are dedicated to that for sleep, or you can do all the natural things first and get results here before you have to go over to the dark side. Thanks for listening.